Disasters can strike at any time, anywhere. The time for volunteers to get involved in emergency response is now, before an incident occurs. A dedicated group of Americans who are making a difference in people's lives. That is the Medical Reserve Corps, keeping their communities healthy before, during, and after a disaster. Neighbors helping neighbors, not just in a crisis, but supporting community health throughout the year, providing flu vaccinations, screening people for diabetes, kidney disease, and high blood pressure, and educating children and families about the importance of healthy eating and physical activity, and much more.
Local volunteers are critical to any emergency response at the local level. Any community that has experienced any emergency of any kind has recognized that all emergencies are local events first. And we need local volunteers, people who know the community, like the Medical Reserve Corps. They know the people, the geography, and the resources of our community, and they help extend the reach of the professional responders.
Volunteerism is more important today than ever. With the state of our economy, I can't think of any local health department that hasn't seen cuts in its staff due to either budget or attrition. The role of the Medical Reserve Corps has become even more critical, not only in helping local public health deal with the emergencies, but deal with the delivery of the services that it needs to do on an everyday basis. As a local municipal leader, I have come to depend more and more upon the role and the help of our Medical Reserve Corps. They have not only assisted us in the delivery of emergency medical services, but have helped us in the delivery of everyday services that we need to deliver.
Annually, Virginia Medical Reserve Corps volunteers provide over $650,000 in volunteer service. They're building stronger, healthier, and better prepared communities. But truly, their value is priceless.
The time to volunteer for the Medical Reserve Corps is not when there's been a disaster or an emergency, but when there has not been, because the role of the Medical Reserve Corps today is more than just responding to a disaster. It's helping local public health respond to the needs of the public, which in some cases can be everyday services that need to be critically provided.
The Medical Reserve Corps is a national network of local groups of volunteers who help to strengthen public health, reduce vulnerabilities, expand emergency management capabilities, and build resiliency in their communities. Medical Reserve Corps volunteers include medical and public health professionals who can provide care to the community members, and also non-medical professionals who can provide leadership, communications, logistics, and other support. After 9/11 and the anthrax attacks that followed later that year, a lot of people wanted to help out, but they weren't prepared in advance. What the Medical Reserve Corps does is helps to train and prepare people in advance, make sure they're comfortable with their roles, and help their community on a regular basis.
The Medical Reserve Corps is a national network of local units in all 50 states and whose efforts impact the health and safety of millions of Americans. While the network is led out of the Office of the U.S. Surgeon General, each unit is developed and managed at the community level.
Because of this local focus, the community get the services that they need that best improve their public health. The list of needs is long, but MRC units across the country are helping to meet those needs. MRC units are also integrated with their local emergency management system so that if a disaster does occur, they're ready and able to assist as needed to help with things like emergency evacuation shelters or points of dispensing for medications and vaccinations.
Today in Fall River, Massachusetts, we conducted a public flu clinic using our Medical Reserve Corps volunteers, both medical and non-medical, to support the Fall River Public Health Network. We provided not only vaccinations, but also nasal spray mist, and we did it in conjunction with the Massachusetts Department of Public Health, rating this clinic for an emergency dispensing site drill to check on our preparedness in case of an emergency.
It's a lot easier to come here for the shot. For one, it's free, and our medical insurance doesn't pay for the shot, so we would have to come up with the money to pay for it. Right. And my husband's out of work right now, so this makes it a lot more convenient for us, and obviously cheaper than having to pay to go to a doctor to have it done. Yeah. So otherwise we might not have had taken the flu shot.
As a public health volunteer, I find it very important that we give back to our community. Post 9/11, I had skills that I wanted to give to the community, but I had no way of doing this. The Greater Fall River Medical Reserve has offered me the opportunity to give to the community, to participate as a volunteer in a nursing capacity.
Well, I wanted to go to medical school, and I wanted to find opportunities where I could serve as well as learn useful things in a similar or related field, and I found that the Medical Reserve Corps allowed me to gain first-hand experience and training, as well as learn other things in new areas like public health, things that could be directly applied to the field of medicine.
I knew that the Medical Reserve Corps was a place I can go to that was safe and that they had professional personnel there, so I knew I can go there. I got a warm meal, I got something to drink, and I got a place to rest, and I knew I could sort out the other details of what was happening at the time, so it was a really good place for me to go.
It takes a dedicated team to keep our communities healthy, safe, and ready for the unexpected. As a member of the Medical Reserve Corps, you will provide a vital service, enhance your skills, serve your community, and enjoy the shared mission and values of like-minded people. For more information or to find a Medical Reserve Corps unit near you, please visit www.medicalreservecorps.gov or email us at mrccontact@hhs.gov.